Well, hello, this is Allison, and she's a registered dental hygienist. Can you tell us how long you've been a dental hygienist?
Yes, I've been a dental hygienist for 29 years, going close to 30 now.
Okay. And can you tell us, not only do you do hygiene, but you also teach hygiene?
Yes, I do. I am currently an adjunct faculty at 2 Southern California schools and have enjoyed that factor of my experience very much.
And also, I understand that you also help dentists, and you also are a consultant for dentists. You go into their dental practices and help them with their hygiene team, and
yes, that's right. We do. I'm working currently with a company that what we do is we go into offices, dental offices, such as we have here, and they have a number of dental hygienists on their team, and what we try to do is help them to become a more cohesive team and helping their patients to have better oral health as well as good systemic health.
Okay. Patients come into the office, and I see them on Twitter, and they tell us that we stab them, that's why they bleed. Can you tell us a little bit about perioprobing and what that involves, and why does it bleed when we touch their gums?
That's a really good question. Yes, we do hear that quite often, and one of the factors that we look at is the fact that the space between the gum and the tooth, because we know we lose the attachment or the surrounding support or the foundation around the tooth, and that is the only way that we can actually measure to see whether or not a person has active disease or if a person is in a beginning phase of disease. So what the bleeding or the tenderness that they're actually feeling is the result of an infection of the bacteria being at the base of their pocket, we call it, and it's ulcerated. So as a result, when we take that periodontal probe down to the base there, it's like picking at a sore. So as a result, that patient's going to feel that tenderness.
Okay, but it shouldn't bleed when you touch them with...
Absolutely not. A healthy gingiva is tight, it's firm, it springs back, it's pink, and there should not be any pain at all when somebody measures that space between their gum and their tooth.
Some people are afraid to come into the dentist or the hygienist. How do you see your role in helping them through their fear of dentistry?
Well, that is true. Number one concern, patients don't come to the office is because they are fearful, and I think a lot of that is because they are not aware of what is going to transpire or take place. And that's one of the reasons why I really enjoy Dr. McAllister's office, is because we ask that patient their concerns and what it is that they are trying to achieve by coming to our office, and how we can help them to have a better oral health as well as systemic health as well.
Well, thank you very much.
I don't like